This is Molly Arthur with CMCM Channel 26 Public Access TV and Seriously Now, a progressive TV show. And I'm at Bioneers conference, and I'm welcoming Dr. Gabor Mate, who is a preeminent Canadian doctor who specializes in the study and treatment of addiction and attention deficit disorder. He's a pathfinder in mind-body medicine, and he describes how adverse childhood experiences can be reversed and healed. He's an author of 4 books, one In the Realm of Hungry Ghosts, and the other When the Body Says No. So Dr. Mate, you talked last night on a panel about how the brain gets addicted. If you might describe to us how that happens, and are we then not responsible for our actions? Is it just that we're diseased and we're incapable then of making personal choices? How does that all work together?
There are 3 ways to understand addiction. One is that it's a choice somebody makes, pure choice based on lack of will or ethical lapse or just stupidity, which is of course the dominant view, and if that's what we believe, we're going to just deter people by draconian punishments. The second perspective, that it's a brain disease based on genetic predisposition, and if that's what we believe, then we don't have to look at the social factors that contribute to addiction. Now, actually, what happens in addiction is that if you look at the people who become heavily addicted, invariably they're abused children, traumatized children. Childhood trauma, childhood stress, childhood loss of nurturing relationships actually shapes the brain in certain ways. Brain circuits, brain chemicals that then make a person more susceptible to addiction. Because what is not true is that drugs are addictive. Drugs are clearly not addictive in themselves. If they were, anybody ever tried a drug would become addicted. But most people who try any drug, whether it's tobacco or alcohol or heroin or cocaine or crystal meth, never become addicted. So the question is, what creates susceptibility? When you look back on that, it's the childhood trauma, the childhood stress that affects the brain circuits in such a way as to make a person susceptible. Secondly, those same experiences then also induce a lot of emotional pain, which then the addict tries to soothe through the addictive behaviors and substances. So do we blame people there? The question is what you mean by responsibility. If by responsibility means that we blame people, how can you blame somebody for having a certain type of brain development that was induced by trauma they did not seek out and had no choice over and could not escape? So we need to get off this blame trajectory and actually look at what is it that causes addictions, and then how do we help people afterwards?
So you have ideas on how to help people afterwards?
Well, what we do know is that the brain is capable of new development even later on in life. It's much tougher later on. It's much better if you get it right when you're developing, when you're in the womb actually, and in the early years, childhood, teenagehood. But we do know that people can transform and develop new brain circuits, regulation over circuits that otherwise are unregulated. But for that, they need the right environment. So to help people heal, we have to give them exactly what they need, which is not punishment and control and ostracization, but actually a lot of patience, a lot of love, a lot of support. That's what people need to heal, which allows their brain to then rewire itself.
So, Dr. Mate, what part actually does the birth play, the active birth, in this discussion about the brain and addiction?
In terms of long-term outcomes, whether we're talking about addiction or physical illness or mental health conditions, the early experience has a huge impact, including the birth experience. We actually need to step back 9 months and say that the mother's emotional states during pregnancy already has a huge impact on the child development. So you can show that if you stress women or animals in a laboratory, their offspring will be more likely to have issues later on, including developmental and learning problems. Now, the birth experience, insofar as it's medicalized, insofar as it interferes with the natural bonding between mother and child, insofar as it stresses both of them, also has a negative impact. And in North America, we've gone far away from natural bonded childbirth practices. In fact, the cesarean section rate in my part of the world, which is British Columbia, Canada, is about 35%. So what we're saying now is that an increasing number of women can't even deliver babies naturally anymore, or we don't give them the help to do so, and that does have an impact on the child development.
You talked about opening people's hearts to create empathy. How does that happen? Is that a characteristic actually that can be destroyed by the biology in the brain and the addiction that you're talking about?
Empathy is a natural human quality given the right environment. If we develop properly according to our actual true nature, we have natural empathy. That's just how it is. So the question is, what interferes with the development of empathy, and what would open it up again? Well, what interferes with it is when we defend ourselves against our own vulnerability. So then we shut down our hearts because we don't want to be hurt. Now, the more stress we experience as children, the more we protect ourselves by shutting down. So it's not that the empathy is gone, it's just that we lose access to it because we're too defended against feeling our own pain.
Right.
So then, development of empathy then actually implies, again, providing an environment where people feel safe, they can let go of their defenses, and that'll open their hearts.
And very clearly in the film last night, they talked about oppression. And so how is pain related to oppression?
Well, where I work in Vancouver, Canada, British Columbia, we have a huge problem with our First Nations population. What you might call American Indians, we call them First Nations peoples, the native Aboriginal population. Their rate of addiction is far higher than the rest of the population. Their rate of incarceration is eons higher. Their rate of suicide and all kinds of mental illness and so on is also increased. Now, that wasn't true of them in their natural state. What has happened is historical conditions, including centuries of oppression and loss of lands, livelihood, spiritual ways, and on top of that, the sexual abuse of their children for 100 years in enforced residential schools, which went on in Canada for multiple generations. This is what interfered with their ability now to nurture their kids in such a way that would allow for their healthy development. So this is a clear case of economic, political, and you might say racial oppression that then has a totally negative consequence on how children and human beings develop.
You talked very much about the humanity of our audiences. So how do we speak to the humanity of the audiences that we want to reach with our message? Big question.
How to speak to people in such a way that their own empathy is open, that their own humanity is enlivened. I think you have to speak with a lot of patience, non-critically, and with a lot of understanding why in this culture people tend to be somewhat shut down when it comes to emotional insight and empathy. But nevertheless, that their true nature is still that they're human beings, still that they want to be empathetic, they want to feel good. I mean, the reason everybody feels so good at Christmas time is all of a sudden we have this cultural permission to actually have some humanity and to have some caring. The rest of the year, this culture inhibits that. It discourages it. But at least for a short time every year, we all have the opportunity to feel connected and feel human.
And give gifts.
And give gifts and to think about other people's needs. Now, that can be a difficult time for people who are isolated and alone. They feel their sense of separation. But for a lot of people, it's a wonderful time because they actually get to experience their own humanity in the way they could and would like to experience it all the time. That's just who we are.
So it's getting back to who we really are and being able to talk and speak to that part of each other.
It's a question of recognizing how this culture actually gets in the way of who we are and of going beyond what this materialistic culture actually would impose on us in terms of outlook, ideology, and relationships.
So you're going to do a panel, I think, on the materialistic society that we're in. And does that tie in? So we're talking about the consumerism that makes us inhuman, possibly.
What materialism means is that control over materials and ownership of materials is more important than human relationships, than empathy, than spiritual values. So it's the God that we worship. And if that's the society that we live in, and that's what the society teaches us, that means a distortion of who we actually are. And so that has toxic effects on human beings.
Does this tie into class and dominance, the full system of oppression?
Well, in a materialistic society that values possession and control, there's going to be naturally a class of people who possess and control. And there'll be many, many others who are, to varying degrees, excluded from ownership and control, and therefore from meaning, and therefore from their genuine power. So this is a society of enforced powerlessness for the vast majority. And that does not lead to positive consequences for people.
So the way to change that, I guess, is what we're looking to understand as a Bioneer and at this conference.
You know, I don't believe I can be here giving prescriptions for how to change society. All I can do is say what I see, open people up to what I perceive to be reality. And if more people do that, more people will get engaged with the issue of how to move things forward in a more humane and positive direction. And that's what I'm looking for. But I'm not looking to tell people what they need to do or how they should do it.
To have clarity.
I mean, I do have my own ideas about that, but it's not a matter of prescriptions. It's really a matter of a process that emerges in people based on their own understanding.
So first of all, working to build our humanity and our capability of empathy with our world, so that then we can figure out where we may be making a change that is better for our children and our grandchildren and the world.
For me, it's all about truth. Let just people look at how it actually is. Let people open their eyes to how it actually is, how it works, what the consequences are, and then let them think about whether that's what they want or not.
So is it hard to say the truth and speak the truth to power?
Power doesn't ask me very much as to what I think. You know, I rarely get invites from. I mean, President Obama's never called me out. The Canadian Prime Minister Harper's never phoned me. So I have never had much the experience of talking to power. It's not difficult to speak the truth. In fact, it's the easiest thing in the world because it's what's natural. Everything else is a denial of who we are and takes a lot of effort. If anybody's ever been in a relationship where they couldn't speak the truth, that takes a lot of effort to suppress our truth. So that's not very hard, I don't believe. Power, however, doesn't wish to listen because power has its own agenda. When I've had the opportunity to address power holders, like politicians, they tend to be very polite, very appreciative, but it's not a question of going in one ear and out the other. It doesn't even go in the one ear because they are defended against that because their particular agenda is entirely different.
So is it uncomfortable with a possible sense that you're the lone voice in the wilderness?
Nobody is a lone voice in the wilderness. I'm not a lone voice in the wilderness. I'm here at a conference with, I don't know, several thousand people who are looking for, or at least asking the right questions. We may not all come up with the right answer or the same answer, but how can I say I'm alone when I'm here with 3,000 people? And wherever I go, there's a lot of people who are asking those questions, who want to look at reality in a different way, in a more authentic way, in my view. So it's not a matter of being alone. No, it's true that in the medical profession, there are a few voices who would be saying what I'm saying, but there are voices, an increasing number of them. So that, it's like Noam Chomsky said. He said, strategically I'm an optimist, but tactically I'm a pessimist. Which means that in the long term, he has faith that reality will assert itself. In the long term, in the short term, it's a difficult process because there's a lot of natural resistance on the part of those who are invested in how things are.
That's wonderful. I appreciate talking with us, making it clear, and standing in your truth, and using a prophetic voice in a way that the world may open their eyes and see.
Well, thank you.
Thank you, Doctor.
I wish I could tell you that a few years from now, what I have to say will no longer be timely, but I'm not that optimistic. When we look around this society and from the perspective of health, what do we see? We see that 50% of adults in this society, which considers itself the most successful society in the history of the world, actually suffers of some chronic illness, heart disease, high blood pressure, cancer, whatever, autoimmune disease, whatever it happens to be. 50% of adolescents today are now set to meet the diagnostic criteria for one or another mental health condition. There are 3.5 million children in this country who are receiving stimulant medications for ADHD. And in my own country, Canada, the number of prescriptions for ADHD has gone up 43% in the last 5 years. There are 500,000 children in this country who are receiving antipsychotic medications. Not because they have psychosis, but because they are upset and their behaviors are problematic. What we have here is the massive experiment in the chemical control of children's brains without knowing what actually the long-term effects will be. I know that in Vancouver, British Columbia, where I live and work, there's a clinic at the Children's Hospital specifically to deal with the side effects of antipsychotic medications on children. In the United States, the antipsychotics, risperidone and Seroquel, I think are in the top 4 to 6 prescriptions given out in this country, not to mention the antidepressants. Now, how do we understand all this in this very successful society? Well, medicine, mainstream medical perspective in which I was trained, basically looks at it from a very strictly physical point of view. Mainstream medicine separates two areas that can't be separated. One is separates mind from the body. So we treat the body as a discrete entity without reference to people's emotional and spiritual lives, number one. And number two, we separate the individual from the environment as if the individual was not affected by the environment. Now, I'll give you 3 examples of how that's simply not applicable. It's been studied now and well documented that children whose parents are stressed are more likely to have asthma. So in polluted areas where the air pollution itself acts as an irritant and therefore increases the risk of asthma, which represents an irritability of the airways, it's the children of parents who are most stressed who are most likely to have asthma. In other words, the psychological, emotional states of the child, of the parent, I should say, affects the physiology of the child's lungs. And how do we treat asthma? Guess what? We treat them with stress hormones, adrenaline and cortisol. But we never ask ourselves, does stress have something to do with causing these kids asthma? In Australia, to give you another example of what I mean by the biopsychosocial nature of human beings, which is to say that our biology is shaped and affected, influenced for a lifetime by our psychological and social relationships and environment. In Australia, they looked at 500 women or so with breast biopsies for suspicious lumps. Now, before the results came back, these women underwent a psychological interview. It turned out that if a woman had been emotionally stressed prior to the onset of that lump, that by itself did not increase the chance of that lump being cancerous. 0 effect. Similarly, if a woman was emotionally isolated, that had no effect either. 0. But if a woman was emotionally isolated and stressed, the risk of that lump being cancerous was 9 times as great as the average. Now, the physicians couldn't figure this one out, because logically speaking, how do 0 and 0 add up to 9? How does 0 and 0 multiply to 9? But if we understand that human beings' physiology is affected by their relationships, then we see that when stress happens, cortisol elevates in the body, which is a stress hormone, which suppresses the immune system. Adrenaline increases in the body, which disorganizes the nervous system. In the short term, they help you fight back or to escape, but in the long term, they actually can suppress the body. No wonder then that people who are isolated and stressed are more likely to develop disease, which is to say that the disease is not simply a manifestation of some physical process unique to them, but it reflects their particular lives in a particular environment, in a particular culture. And finally, at the end of life, a study in the New England Journal of Medicine some years ago showed that a couple who've been together for a long time, when one of them is hospitalized, the other one has a significantly increased risk of dying, which is to say that the physiology of us human beings is very much affected by the environment. And that is what may be called, and I refer to as a biopsychosocial perspective. We think that may be new. Well, it's revolutionary as far as mainstream medicine is concerned, but it's certainly not new. The Buddha said 2,500 years ago, he talked about the interconnection of everything, what he called the interconnected co-arising, interdependent co-arising of phenomena. So he said, look at a raindrop. It doesn't just contain itself. You can't just understand it as an isolated entity. In fact, it contains the sky. Look at a leaf. It contains the sky in terms of the irrigation. It contains the earth in terms of the materials that go into it, and the sun in terms of the light that's needed to make it grow. And he said that the birth and death of any phenomena are connected to the birth and death of all other phenomena. The one contains the many, and the many contains the one. Without the one, there cannot be the many. Without the many, there cannot be the one. And that was said 2,500 years ago, a lesson we're still trying to integrate and to understand and to apply to our lives. Now, I know that at a conference such as Bioneers, the emphasis is very much on the physical environment, particularly what we're doing to nature. And that's valid and necessary. But I think we need to broaden our view of the environment to actually include also the social, relational, interactive, and cultural aspects as well. Now and also the economic ones. So for example, a study a little while ago showed that when women who are pregnant breathe in polycyclic aromatic hydrocarbons, their children are more likely to have behavior problems by school age. So we think this is simply a physically environmental problem. No, it isn't. It's also a socioeconomic one, since it's poor women who tend to live in more polluted areas. And therefore, the medical scientists who did the study at Mount Sinai University School of Medicine, Mount Sinai School of Medicine in New York said, this is really a paper about social justice. Poor people have more exposure to these things on all accounts, whether bad air or psychosocial stress and other things. That's a societal problem, and the changes are not going to be on an individual level. They're going to be on the societal level. You can't separate individuals from an environment. Or to take another example, we know that lead exposure actually disturbs the nervous system, leading to learning and behavior problems. But amongst poorer kids who have an iron-deficient diet, that promotes the absorption of lead. So it's not just a lead problem, it's a socioeconomic problem on account of the poorer diet that these children have. So when I talk about the toxic culture that a materialistic society offers its members, what am I referring to? Well, materialism is really a system of belief or behavior which considers material things, and particularly the control and possession of material things, as more important than human values such as connection, love, or spiritual values such as recognizing the unity of everything. And that's the kind of culture we live in. Interestingly enough, the religious right, in their opposition to the very idea of climate change, or to the idea that the environment is important to look at, they will quote the Old Testament where man is given stewardship over the earth and all other creatures. But when they talk about stewardship, they mean control and dominance. There's another way to look at stewardship, which is caring and nurturing for, looking after. And in the materialistic sense, it's that control and ownership that we look at. And that means that the culture itself, quite apart from the physical toxins that we spew into the environment and the way in which we're altering the very air that we breathe and the very sun that beats down on us, that shines on us, we actually are affected also by the toxicity of human relationships or the lack of human relationships that this kind of a society that emphasizes material values teaches us to pursue. And from that perspective, we have to understand that medicine is not simply a science. It's much more than that. It's also an ideology. It's also an ideology. It's a way of looking at human beings. So when we look at human beings as individuals without understanding the importance of their social relationships and their emotional, psychological interactions with others, that's actually a manifestation of the individualistic perspective of the entrepreneur who says that only I matter and what I gain or what I control matters, and we're all in competition with one another. So you see that economic ideological perspective also showing up in its own particular way in the practice of medicine. Well, reality is totally different. Reality tells us that we can't be separated, and this begins already in pregnancy. So a study out of Johns Hopkins University in 2004, for example, showed that the reactivity to stress of the fetus is affected by the stress, depression, or anxiety of the mother. So when you look at the heartbeat and the movement of infants in the womb, whose mothers are stressed, depressed, or anxious, you see different patterns of activity, and that will have lifetime effects. The studies reflect, this paper says, growing evidence that stress and depression can have early and lasting effects on the child's life, including increased behavior problems, including learning problems. And we also know that if you stress pregnant animals in the laboratory, their children will be more likely to use drugs as a way of soothe themselves once they've grown up. So this mind-body unity and this interaction of the environment and the individual begins already in the womb. And therefore, how we treat pregnant women, how we provide an environment that's either supportive or possibly stressful, has a huge impact on the long-term development of their yet unborn offspring. And this, of course, happens during infancy as well, because that's a crucial period of brain development, so that the infants of healthy mothers have very different cortisol stress hormone levels than those of mothers with postpartum depression. And if you look at the electroencephalograms of infants with postpartum, of mothers, the electroencephalograms of the infants of mothers who have postpartum depression, you can tell from the EEG of the child who's depressed and who isn't. So the child's electrical circuitry is already affected at 6 months of age by the mood of the mother. Now, in this society, 20% of women suffer postpartum depression, and another 20% have some symptoms of it. Now, that's not because of an individual problem on the part of the mother. Depression is not an individual issue. It reflects your relationship with the environment. And therefore, in this successful society, we're managing to depress 20% of women who give birth to babies. And that will have an effect on the child's brain hormone levels and neurotransmitter levels like dopamine and serotonin, and on the child's ability to respond to stress in a positive or in a highly charged and dysfunctional way. The good news is that human beings can regain their sense of connection to themselves, just as we can regain our sense of connection to our nature. I will make just one final point here about the economics of it. A Harvard study 3 years ago showed that the lack of medical insurance in this country leads to 45,000 deaths annually. This is not an ideological question about healthcare. And most recently, President Bush said, well, there's no problem. Everybody can show up in the emergency ward. Sure you can. Once you've had a stroke because you didn't get treated for your high blood pressure, which you got because you were so stressed, you can go to the emergency ward and you get treated for your stroke. But the lack of health care that's available to people, which is very much a social economic question, it itself is a significant factor. Well, the good news is that we can regain a connection to ourselves. And empathy, which is a genuine human quality, is in us. We're actually wired for empathy. Even rats are wired for empathy. When you stress rats in the laboratory by shocking their feet with electricity, they're more stressed watching other rats being shocked than when they're shocked themselves. Their stress hormone levels are higher. That's our nature as human beings. So contrary to the myth in our culture that we're separated individual, aggressive, competitive creatures, we're actually wired for empathy, wired for connection, wired for love, wired for compassion. So really, to move forward, all we have to do, not an easy task, but it's certainly available to us, is to get back to our true nature. Thank you.